As we've seen in the previous reports, it's not an exaggeration to say that COVID-19 completely upended our lives for the past 3 years. To talk us through some of the ups and downs we faced, we have our Son Yujin in the studio. Welcome, Yujin.
Great to be back, Tommy.
All right, what a big announcement just in time for the Lunar New Year holiday. I mean, just a couple of weeks ago, I remember you and me talking about over the possibility of lifting the indoor mask mandate, and it has come true. So let's talk about the public sentiment.
Well, first of all, Tommy, it's been 3 years since we start wearing masks, so it's quite hard to imagine ourselves without masks now, but still, a majority of Koreans have been waiting to go mask-free. A survey done by the Korea Chamber of Commerce and Industry late last month shows that out of the more than 1,600 Koreans surveyed, almost 3 in 4 were for scrapping indoor mask-wearing rules, and the main reason given was wanting to breathe freely.
Right, we've all accustomed to wearing masks, but I still miss the days when we didn't have to, right? And mask wearing is not the only inconvenience that the virus gave us. Think about all the border restrictions, mask mandates, testing mandates, and curfews, right? But it was tough, but now that I think of it, South Korea has done quite a good job handling the pandemic, right?
Well, I couldn't agree with you more, and we owe a lot to what is now being called the K-quarantine model. And to provide a specific explanation of that, it's South Korea's very own strategy of dealing with viruses based on the 3 T's. And by 3 T's, it stands for testing, tracing, and treating. And this model has been receiving a lot of attention and positive feedback from abroad. So I want to ask you, do you remember during the early days of the pandemic how people were lining in front of testing centers and screening clinics for hours just to get their COVID tests?
Let me tell you, I've wasted lots of hours on the road just to get tested. On weekends especially, it would take me hours just to get tested.
Yeah, I absolutely agree. And the main reason was because there weren't a lot of COVID testing centers when compared to now. And this actually increased the risk of getting infections because face-to-face contact between suspected patients and also the medical personnel was inevitable. And that's the reason why South Korea introduced the so-called drive-through testing stations. And here, drivers were able to pull into special parking areas where health workers would come to vehicles to check their temperatures and use swabs to take samples from their noses and throats. And this was a really big game changer because this entire process would only take about 5 to 10 minutes.
Right, from hours to just 5 minutes. That's
Right.
a huge step. I do remember those stations were surely a big help to overwhelmed testing sites. Now, talking about COVID tests, South Korea also developed test kits too, right?
You're absolutely right. And South Korea actually standardized the usage of real-time PCR tests. And this RT-PCR test method, it really shortened the entire time of testing from about 1 to 2 days to 2 to 6 hours. So this was also a very big change in the COVID era. And these testing kits have now been exported to over 100 countries worldwide. And we also have to talk about the innovative tracing methods, particularly the QR code-based vaccine pass. And when we saw COVID case numbers surging, do you remember how we had to show our individual QR codes when entering restaurants, cafes, libraries, and all those public venues?
Right, phone was a must-have, especially during those days.
Yeah, and I couldn't agree with you more. And I also want to talk about that overall, a lot of foreign outlets talked and praised about how Koreans were quarantining and wearing their masks so well. They especially highly evaluated Koreans for voluntarily staying home, refraining from taking part in mass demonstrations, traveling, and also holding church services online.
Right, we were able to get through those difficult times thanks to all the team effort between the general public and also the medical staff. Now, from the very first of the pandemic, they've been working nonstop, right? The medical workers.
Especially, right, we also have to talk about the contributions and efforts they have made. And especially when the pandemic first started and we saw case numbers skyrocketing, these medical staff, they had to literally work around the clock without weekends and holidays. So I want to ask you, do you remember the heartwarming thank you challenge?
Right. It was really heartwarming to see all the posts on social media expressing gratitude to those frontline medical workers. It was really nice.
And you're definitely right. And this campaign, it really received a lot of public recognition and it became really popular as a lot of well-renowned celebrities also took part in the challenge. And to name a few, it included the then South Korean President Moon Jae-in, Olympic gold medalist Kim Yeona, and also, of course, K-pop sensation BTS.
That's right. Before we let you go, Eugene, lifting the indoor mask mandate doesn't mean we're done with COVID. I mean, as you yourself as a reporter out on the field, just keeping track of the COVID-19 situation here in the country, updating us from day one, what do you think we should be mindful of moving on?
Well, I just want to say that it's never too bad to be careful. We still have to wear masks on public transportation, at welfare and care facilities, and also in medical institutions. And health authorities will decide whether to scrap the mask wearing rules in these venues after monitoring the virus situation. And besides masks, vaccines have proven to offer strong protection. Health authorities have been encouraging people in the country to get the updated bivalent boosters, and they're known to be really effective, especially against the highly transmissible Omicron variant and its various sublineages. But currently, only a little over 12% of people aged 12 and over have gotten the jab. So maybe rolling up your sleeve and getting the vaccine might be a good protection method.
Right, starting January 30th, we don't have to feel so bad not wearing masks here in the studio, right?
Right.
All right, thank you so much for joining us again today, Eugene.
Always a pleasure.